I have a 2-year, 7-month-old male here with his mother for a 30-month well child exam. The family is here to establish care. He is eating a variety of foods 3 times per day with 1 snack per day. He is voiding well. He is potty trained. He drinks out of an open cup. He limits milk to 16 ounces per day and juice to 4 ounces per day. He is talking, running, jumping, climbing, naming colors, drawing lines, and pointing. He is not in daycare at this time. Mother reports he is homeschooled. His immunizations are up to date. Mother is wanting the child to receive an influenza vaccine today. He is in a rear-facing car seat. He sleeps in a toddler bed at home. The caregiver has no concerns. He has a past medical history of night terrors at around 1 year of age. The family did see a neurologist for this issue. The mother reports the night terrors have since resolved and are no longer an issue. He has no past surgical history. He's not on any medications, and he has no known allergies. He has a mother who is 28 and living. His father is 32 and living. His brother is 2 months old and living. There is no pertinent family medical history. He lives at home with his parents and baby brothers. There is no smoke exposure or pets in the home. The home was built before 1978. The mother denies changes in activity level, fever, changes in weight or appetite, malaise or dyspnea. Denies changes in vision, hearing, light sensitivity, sore throat, runny nose, otorrhea or discharge. Denies trouble eating or drinking. Denies any wheezing, cough, dyspnea, or respiratory illness. Denies any feelings of dizziness, chest pain, or history of murmurs. Denies abdominal pain, vomiting, constipation, bloody stool, or diarrhea. Denies signs of dysuria or hematuria. Denies any musculoskeletal pain, weakness, or trauma. Denies any rashes, color changes, or concerning lesions. Denies any loss of consciousness, seizure activity, trauma, or signs of delays, no night terrors in over a year. Denies any decreased energy levels. My differential diagnoses includes routine well child health exam. The American Academy of Pediatrics recommends that all children follow the well visit schedule as outlined on their website. This child is 2 years and 7 months old, and he is due for his 30-month well child visit. My second differential diagnosis is immunization. The American Academy of Pediatrics strongly encourages families to follow the recommended vaccine schedule for children to prevent certain infectious diseases. It is recommended that children ages 6 months or older to receive an influenza vaccine annually to limit the spread of influenza. My third differential diagnosis is lead screening. It is highly encouraged for children who are at risk for lead poisoning to be tested for lead exposure. Because the child lives in a home built before 1978, he is at risk for lead exposure. This child should be screened for lead exposure by testing a blood sample at today's visit. My fourth and final differential diagnosis is hemoglobin screening. The American Academy of Pediatrics has updated its guidelines to reflect screening recommendations for iron deficiency anemia at ages 12 months, 15 months, and 30 months of age. This child should be screened for anemia by testing a blood sample at today's visit. My physical examination findings include a pulse of 91, a temperature 97.5 degrees Fahrenheit taken tympanically, 28 breaths per minute. He is 97.5 centimeters tall, and he is 32 pounds and 6 ounces. His head circumference is 50.6 centimeters, and he has a BMI of 15.4. He is in no acute distress, non-toxic, well hydrated. He is normocephalic, atraumatic, anterior fontanel is closed. His pinnae are without deformity, external ear canals without edema or arrhythmia. Tympanic membranes are gray with good light reflex. Positive red reflex bilaterally. Pupil equal, round, and reactive to light. Conjugate gaze, sclera without injection. His nose is patent without discharge, turbinates without bogginess or paleness. He has moist mucous membranes, no oral lesions, pharynx without arrhythmia or exudates. He has normal dentition for his age and good oral hygiene. His neck is supple with full range of motion, no lymphadenopathy or masses. His lungs are clear to auscultation bilaterally, over all lung fields. No wheezes, rales, or rhonchi. Cardiovascular, normal S1 and S2, regular rate and rhythm. No murmurs, rubs, clicks, or gallops. He has normal active bowel sounds. They are soft, tender, and non-distended. No rigidity, rebound, or guarding. No hepatosplenomegaly or masses. He has no musculoskeletal deformities. He moves all extremities well. There is no cyanosis, clubbing, or edema. He is alert and appropriate for age with no focal deficits. Symmetric facial expressions, normal tone, and cranial nerves are grossly intact. He has normal male testes, descended, and normal phallus. He is an SMR1. He had 2 diagnostic screenings today. The first one was for a lead screening, which was low, and he had hemoglobin screened for anemia. His result was 15.6, so both results are within normal limits, so we're not concerned about that. My diagnosis for today is encounter for a routine child health examination without abnormal findings. The American Academy of Pediatrics recommends all parents and pediatric healthcare providers follow the guideline schedule for periodic well child exams. The patient is here for his 30-month well child exam. There were no parental concerns or abnormal findings found during the physical exam or review of systems. My second diagnosis is encounter for immunization. The American Academy of Pediatrics strongly encourages all families and healthcare providers to follow the immunization schedule for the recommended vaccinations. The patient is due for an influenza vaccine today. My management plan is as follows. Again, the patient was here today for a routine child health examination without abnormal findings and encounter for influenza vaccine. The plan for today is as follows. Parent agrees with plan for influenza vaccine to be administered today. The rest of his immunizations are up to date. Immunization record and school form given. Tylenol dosing discussed with parent. Continue to offer a variety of foods. Offer 3 meals a day with 1 to 2 snacks in between. Offer healthy choices, but let your child decide how much food to eat. Choking is a hazard at this age, so be sure to review list of dangerous foods. Limit juice to 4 ounces per day. Taper from whole milk to skim milk after 2 years of age. Limit milk to 16 to 24 ounces per day. Limit screen time to less than 2 hours per day during the week and less than 2 hours per day on the weekend. Discussed dental care, brush twice daily with a right-sized amount of fluorinated toothpaste. Developmental tasks for age reviewed. There are no concerns. Follow up in 6 months for 3-year well child exam. All questions and concerns were addressed with the caregiver and patient who voiced understanding and agrees with plan.